privileged to do what we all love to do. I have it someplace. Oh, maybe I don't. In any event, we as physicians are blessed with a skill set and knowledge to be able to continue to practice medicine as long as we so care to. I don't think there's ever a day that as a physician you are not asked by a friend or a relative for help. And you know, you might say, well, why would a pediatric cardiologist be involved in taking care of adults? When I was in medical school, my decision was that I thought that I was going to do med-peds. This was back in the 60s, and med-peds was just formulating as a specialty. And so my internship at County General was spent half and half doing pediatrics and internal medicine. I did a month of infectious disease, I did perinatology, I did obstetrics, and I did emergency. And then, if those remember, those who trained in the 60s and the 70s were enrolled in the Berry Plan. And so we were inscripted, if we were in Israel, or commissioned to be in the services. I went in immediately into the Army as I finished my medical school training. And I spent my first 6 months in El Paso, Texas, where I really had the privilege of running a male internal medicine clinic. It's senior NCOs and warrant officers and officers, and even the general. And the only one that had privileges to the back door were the full bird colonel. And sometimes the lieutenant colonels would complain that they weren't getting preferential treatment. But I said, that's the rules. And the general, and they would go and complain to the general, and the general said, Dr. Thomas is right, or Captain Thomas. Well, from there, I spent, unbeknownst to me, when I got there, I then spent a year in Vietnam, at which time I was a battalion surgeon on LZ Debbie and after 3 months transitioned to a MASH unit, and where I worked basically in not only emergent care of the troops, but also we had two units where we would take care of the friendly Vietnamese as well as the GIs. And upon returning from Vietnam, I then did 6 months of pediatrics. So I was really kind of well positioned to do med-peds, pretty much what I wanted to. However, there was a physician here in town. He was the chief of medicine in those days. His name was Dr. Engstrom. Dr. Engstrom, I think, was a very good physician. He was a very good endocrinologist, but wasn't a very pleasant man as far as his willingness to establish a med-peds program that Dr. J.C. Peterson, who was the chief of pediatrics, was very willing to do. And Dr. Engstrom rather belittled pediatrics, and so I rather got up from my meeting with Dr. Engstrom and left and continued in pediatrics. Those of us who trained in the 60s, well, 50s, 60s, and 70s, but probably in the late 60s and 70s, really trained in the golden era of medicine. What do I mean by that? Well, that was when the physical examination and history was the gold standard. This is when you absolutely, you learned how to take care of patients. But it was also a time that during my fellowship, I had the opportunity to be in really the basement of non-invasive techniques. You know, I started echocardiography here in Milwaukee, as a pediatric cardiologist. We were using a machine that I would look into a Polaroid camera and take little clips of M-mode echoes. At the same time, we started stress testing the children. We then had the opportunity to be involved with nuclear medicine, to be involved with the development of MRI and CT scanning. And so we were blessed not only having the skills, but then after establishing a qualitative diagnosis, we could then take the next step and quantitate it. And it was so rewarding for me having a patient come in and challenge, can you make the bedside diagnosis? And I felt very comfortable in doing that and telling the parents and going through a diagram what we're dealing with. And then go to the echo machine and quantitate. And so, with the opportunity of doing that, it just established myself in pediatric cardiology and having Dr. J.C. Peterson, who you would make rounds with Dr. Peterson and he would be able to talk about and make a diagnosis of any systematic disease there is. And Dr. Fred Blodgett and Dr. Bill Gallen. And Dr. Bill Gallen, who was my mentor in pediatric cardiology, was really the father of pediatric cardiology here in Wisconsin, having trained with Dr. Helen Pausig at Johns Hopkins and having trained in Sweden. And so I was pretty well set, to do clinical medicine. And in pediatric cardiology, it was my practice when I was doing my fellowship that I ran the pediatric cardiology outpatient clinic for the Medicaid patients. And it might have been the only time that patient would ever get to the hospital. So I made sure that I would do a complete examination on every patient. We would make sure we would check their vision, we would check their hearing, we would do orthopedic exam, because we don't know when they would get back. And so when I started my practice, I did a complete examination on every patient. It wasn't just I always looked at myself as a physician first, a pediatrician second, and then a pediatric cardiologist. And so as life went on, my patients aged as I aged. And so the discussion was, if you felt comfortable as you passed your 18th birthday, if you felt comfortable to come back, I was more than comfortable to care for you. And so I continued to see the patients such that when I retired, my patients aged from 1 day, because I saw a consultation that day in the hospital, to 45 years. And it was truly a privilege to have done that. And so when I retired, I had some really significant dedication to thinking I could really help pediatric cardiology fellows with bedside exam. But the interest in bedside exams just isn't there. And so after 6 months of frustration, I decided, that's probably not worth my while. And so my wife, dear wife Ann, who was on the parish council at St. Joe's in Wauwatosa, was the liaison to the Human Concerns Committee. And she said, you might want to call repairs to the breach, because I was trying to find a place to move my furniture in my office. A good part of my furniture or supplies actually went down to a clinic in Mississippi, but I still had some major furniture. And so I called Repairs and Breach, and McKenna Brown, who was the founder of Repairs, was more than happy to have the furniture. She said, well, by the way, you think you would like to volunteer here? And I said, well, McKenna, I'm a pediatric cardiologist, and I don't know if my skills would be what you're looking for. Well, I thought about it for a while and realized that I've been doing adult exams for the last 20 years, and I could do that. And so once I knew that I was covered, my malpractice was covered through the volunteer practice committee or volunteer practice policy through the state of Wisconsin. And I thought, well, why not? And so in January of 2012, I started my first clinic. And so I basically, and we're in town a great deal of the time, but on Tuesdays and Thursdays, I run the clinic. Well, what is Repairers of the Breach? Well, Repairers of the Breach is the only day respite for the homeless and underserved here in the sun, in Greater Milwaukee. What do I mean day respite? Well, it's a place, there are night, there are the rescue mission and multiple other units where there's places where the individuals can stay at night, but at 6:30 or 7 o'clock in the morning, they're out of there, and they can't come back till 6:30 at night. Well, the way the breach was set up was to be kind of a bridge for those individuals who are homeless and underserved for a place to go. So they serve breakfast, they serve lunch. There's a number of other services that they have. But one of the real, I think, and I'm a little bit prejudiced, but I think really the foundation of repairs is truly the medical clinic. And so we have had the opportunity with the help of, some very kind young volunteer physicians like Dr. Piper, to actually double the number of patient visits we've seen, because we've had double the number of volunteers, double the number of volunteer hours. And so not only do we provide primary care, but we also are a source of, and with our connections, be able to refer patients to tertiary care clinics. Plus, we happen to have a podiatrist on our staff now, and an orthopedist. So we have a podiatry clinic, we have an orthopedic clinic, we have a physical therapist / occupational therapist who's able to help us. And then we have support of mental health. We also have supports of the HIV organization, which is able to help us take care of these very, very needed people. Then we have another role, and that is of education. Today I had 3 senior nursing students from Marquette. This weekend, Dr. Brian McSorley, who is just another one of our wonderful volunteers, will be staffing the clinic with medical students, first-year medical students. And his daughter, who happens to be a first year, when it came to signing up, there was 80 freshman medical students who wanted the opportunity to get involved. And so we not only are involved with nursing students, medical students, we're involved with the PA program at Marquette, we're involved with what is called an accelerated nursing program, which is just an exciting group of young nurses who have finished their degrees in multiplicity of fields, but have decided they want to go into nursing. And so they're in an 18-month program, and these young ladies, generally young ladies, occasionally a man, are so focused and they are so fun to work with, and they're there in the summer. And so we do a great deal of education. And so I accept this award really with the thought in mind of my colleagues at Repairers of the Breach, of the physicians and the nurses and the therapists and the other paramedical who are there to help us, as well as all the other individuals who volunteer, whether it's stateside or in medical missions. When I came back from Vietnam, I used to run med camps in Vietnam. And I thought, when I finish my service in the service, not only is my service commitment completed, but my missionary commitment is completed. And I further made a promise to my wife that never in my life in medicine will I involve myself practicing medicine that a plane is involved. There's no way that I was going to go anywhere where I needed to practice medicine that a plane was involved. And so, therefore, not only can we do as much service within our own community, we don't have to go, to a foreign land, which I think is phenomenal. I think that is superb. And in fact, my orthopedic appointment got canceled because your Dr. Hackbar is down in Nicaragua on a mission trip. But I really respect that, but I really accept this in really in honor of all those of us who volunteer. And it doesn't have to be in medicine. It could be, you know, a number of our colleagues may be involved in education, and they may be assisting in somewhere. But volunteerism is great, and I accept this award in the name of everyone who's involved. And I thank you very much.